Welcome to Listen Up Now, and to let you know what's going on in your world and my world, your guy, my guy, right guy.
Really awesome interview and show ahead here today. We're joined once again by Miss Airelle Rucker-Smith, doctoral nurse practitioner at FirstChoice Primary Care.
Welcome to the show. How you doing today?
I'm feeling good. How you guys doing?
Doing awesome, and I'm going to jump right into it and say thank you again for joining us. And really quick, I want to know, as an MP, what are the three most common injuries you see come through your door?
The three most common injuries I would say are low back pain, knee pain, and neck pain. Those are definitely our top three.
Absolutely. And then when you're dealing with patients who are suffering with those sort of ailments, what's sort of your first step in diagnosing the problem and sort of the next steps to redirect them from there?
So the first thing we want to do is just take a detailed history and try to see if we can get to the root or the cause of the issue. And so we want to know, was there obviously any injury or trauma? And so if there was injury or trauma, we just need to assess whether we think imaging is necessary at that time. And if we think this is just something that's going to resolve with time, then that just depends on the diagnosis. Or if it's something that we need to send them to physical therapy for, sometimes we do that in the beginning. Sometimes if we think it may, resolve on its own, we may wait a little bit. But then if they're not progressing like they should, we will then send them to therapy or refer out to orthopedists.
Yeah. And how much fun do you have when a client such as myself comes in and says, Doc, I think I blew out every disc in my neck? And the first thing I'm asking for is medication. How do you talk them down from jumping to doing that first and trying to find some holistic opportunities for recovery?
So we really want to again get to the root of the problem and see what the cause of the problem is. If there was like some acute trauma and we really the patient is really in some acute pain, sometimes medication is necessary in the very beginning. But again, we want to assess that pain level, and we kind of want to use those non-pharmacological interventions or the things that are not medications first. And then we want to obviously maximize on that and really getting them to understand, proper body mechanics and ways that we can prevent re-injury. So it really depends on the cause of the pain.
100%. And I know the last time you were on the show, we talked a bit about sort of your background, how you sort of got into this field and, where it's sort of taken you from that perspective. I know that you've been working as an adjunct clinical faculty and preceptor. I just wanted to ask what that role has sort of been like for you and maybe what you've learned from it.
Well, so I've personally learned a lot over the years. So physical therapy is built into the foundation of the nursing career. We work very closely with physical therapists. A lot of nurses start inside the hospital, where we work with collaborative approaches with the physical therapist there. And so for me, I'm not sure if I've shared this before with you guys, but when I started my nursing career, when I first graduated as a new grad nurse, I had a position in the medical ICU at Johns Hopkins, and my position wasn't supposed to start for a few months, and they didn't want me to take a job elsewhere. And so what they did was they created a role for me, and the role that they created was a nursing liaison, working very closely with physical therapist and Dr. Dale Needham, who was one of the pioneers for incorporating mobility programs into the ICU with very critical patients. And so my job was to bridge that role with the ICU nurses and the physical therapist there, making sure that, that safety concerns were addressed. Oftentimes those patients in the ICU have a lot of lines and things like that. And so that was part of my role, and that shaped me. The importance of mobility really carried throughout my nursing career and to now a nurse practitioner.
And during during that time, as you're working with all these different departments, did you see or feel any one of these departments being more inviting for communication with you versus everybody staying in their own lane? Did you find yourself working a little bit closer with the physicians versus the physical therapist, or versus maybe a rehab specialist?
I think because we all started with the same goal, which was to improve patient outcomes. I think that once we all were leading with that goal in mind and addressing any concerns or hesitations that any one disciplinary area had, I think we functioned very well as a team at that point. Because let's say the physicians had a concern. Um, Maybe it was inviting them in to just a part of the physical therapy session to say, hey, this is how we do this, in the ICU, but do it safely with them. And same for nursing and vice versa.
And I know you've talked a lot about, especially in our last interview, about the importance of communication and being on the same page with the team. And I know you guys do such a great job of that there over at First Choice Primary Care in Rockville. Having just spoken with Belinda, I wanted to ask how you work together with her and other members of the staff to make sure that you're always on the same page and giving the most proper and, best care you can to patients.
So we do morning rounds. I take some of the concepts that I used to do in the hospital, and some things that have been proven to minimize miscommunication, right? Because sometimes when you have multidisciplinary members on the team, information can easily be lost. So we round in the mornings on the patients for the day. And then we talk about the treatment plans and if there's areas that we want to focus on for specific patients, or maybe during appointment with the nutritionist, Mrs. Belinda Johnson noticed this with the patient. She noticed this was a driving factor that may impact some of the chronic conditions and that maybe primary care should take a look at this, and vice versa. And so it's always keeping those lines of communication open with the entire team, and also making sure that the patient is an advocate on that team too.
Now, love once again the whole focus on communication, reaching a goal together, and not just telling someone what to do and, we'll see you in 30 days. And I think during the pandemic, I'm curious, as a nurse practitioner in the physical therapy space, we saw a lot of tech neck and different type of injuries due to just being uncomfortable for 8 hours in front of a screen more than most people would like. But in your world, how did the pandemic change the viewpoints or the definition of being a nurse practitioner more to the public? Like, was there a big shift in acknowledgement in all the services you guys provide?
I think that the pandemic definitely put a strain on the healthcare system. I think we all witnessed that. And I do think that it highlighted the value um, of nurse practitioners. I think we were always valued, but I think there was just a light shined, not just on us, but on all healthcare providers during that time. And so I think that now nurse practitioners are definitely, really taking that full practice authority and using it to just help improve our patient outcomes.
Absolutely. And, going along these lines of like sort of the strain that, was definitely felt in the healthcare industry, especially from the pandemic and onwards, what are some ways that you've sort of taken that and been able to innovate your approach to care going forward?
Can you repeat the question again? Sorry, right?
Yeah, no worries.
I got a message over here.
We're
No,
here.
hey, no problem. Yeah, just sort of talking about, the pandemic and how that put a strain on the healthcare industry. I was just sort of curious, what are some ways in your practice and sort of the services that you provide, have you sort of shifted maybe your approach or maybe innovated your approach to care?
Oh, so definitely. We definitely utilize telehealth a lot more. We were using it before the pandemic, but I think during the pandemic, we definitely use it a lot more. Um, it would allowed us to see patients that we may not have wanted to bring into the office, whether it was because they had some symptoms that we did not want them to actually come in, or to protect them because maybe they are immunocompromised. And so telehealth really gave us the functional ability to still provide care to those patients. I would say that's probably the biggest thing that we've done since the pandemic.
Well, obviously, tech is a big focus now in everything we do, but especially in healthcare. And as a nurse practitioner, Did you see any key changes in tech being that would give the client or the patients more ability to access educational information from your practice?
I think that the capabilities that we had as a practice were there before the pandemic, I think, but the pandemic really, I feel like the patients started using it more during the pandemic. Like they wanted to use it, and they were able to learn how to navigate the system a lot easier because we were always able to have video and audio televisits, and they were always able to use the portal to send message. But I think it's definitely utilized more now, and I think the patients actually like it.
Right. And I think something that the pandemic definitely taught us all is sort of how important that communication and collaboration is. And, especially when you're not able to see people face to face and interact, how much more difficult that gets. And that's why, we're so happy to be back in the office and able to sort of regain those key factors there. It did sort of bring to mind for me. I wanted to ask, in this current day and age, how do you best collaborate with different practices and physical therapists in the management and treatment of patients?
I don't hesitate to pick up the phone. I will pick up the phone. I will call a specialist if we have a mutual patient and I'm concerned about. I do that all the time. I personally call. Some of the providers in the area we have each other's cell phone numbers. We have each other's personal lines, and we'll just send a text. Hey, it's a mutual patient of ours. I'm concerned about XYZ. What do you think? So I think it's very important. I actually stopped by a new practice in the area just to introduce myself and got a chance to talk to the providers. So I think it's definitely important for us to keep that line of communication open because we all work together. But when we have access to each other to kind of close that loop of communication and not just, leaving a message, I think that helps, reduce errors and it gets us to our patient goals quicker.
And when you're dealing with, let's say, another physician, what is their first concern or what are they trying to initiate with you as far as communication? Is it just send me reports or they actually want to be more involved once you make contact with them? Because it is important as peer to peer when you're talking to your colleagues that they understand that the information is coming from the source. So I can imagine as a physician, it would make me feel great to know that my patient is being cared or I have the ability to work with someone like you who's taking that initiative to make sure that we have everything done in a proper manner.
Yep, sometimes it's definitely notes. It could be labs, it could be any patient record. And sometimes it may be more a little bit personal, right? So I could be concerned about something that's not necessarily um, a medical condition. I may be, let's just say I'm going to use physical therapy as an example, right? I could be concerned about some of the in-home safety, lack of in-home safety measures. And so I may pick up the phone and say, hey, can I get a call? Or, hey, do you guys have, occupational therapists that you work with? Patient shared this. Do you guys assist with that? And so I think that plays a big portion is not just the medical records. We have more of a holistic care approach. And so we always factor in social and economic factors that are going to affect our patient's health as well. So sometimes those are discussed. And we also will pull in other resources in the community if we see that a patient needs that as well.
Yeah, and that's a really important sort of subject matter. It gets me thinking about that relationship, not only with yourself as a practice and the other practices or providers you may be working with, but also in regards to the patient. We see a lot of times, especially people coming from referrals. Maybe they're going between a cardiologist and they're going between primary care and they're coming to PT for something else, or maybe they're seeing some sort of surgeon for a different issue. Have you seen any sort of struggles or shortcomings in that communication and keeping that accountability in the plan you lay out for them?
I'll be honest, sometimes the communication is not easy and it could be a number of reasons, right? Um, a surgeon may be in surgery. I can't just pick up the phone and call them. Um,
Right.
so for a lot of reasons, it can be difficult. But what I will say that we try to do is we do try to, push. Maybe I can't get a hold of them, but I can get a hold of their coordinator who works very closely with them. So it's just doing all that we can. And sometimes communication takes, it can take more than one attempt. It's just really being dedicated to doing that, and always keeping in mind it's for the patient.
Absolutely. And sort of along those lines, looking on sort of the patient facing side, I was wondering what are some challenges you've seen for patients, as far as trying to incorporate physical therapy for them? Have there ever been times where, maybe they're not remaining accountable or sticking with a plan and you sort of have to set an expectation with them or talk with the physical therapist to make sure that they're clear in following up with the patient?
Definitely that it does come up. I think when I refer a patient to therapy, my recommendation is that they follow the physical therapist's recommendation, and that I would like them to at least be going to therapy at least twice a week for at least 4 to 6 weeks. They have to be consistent, at least. And that plan can change or be altered by the physical therapist as they see fit. And so I make that kind of like the expectation or the goal from the very beginning. I talk to the patients about being consistent and compliant with their physical therapy plan. And I think that's very important to start with that.
Now, more importantly, when you're dealing with patients who have chronic conditions like arthritis or osteoporosis, forgive me there, uh, do you have to sit your patients down and really explain to them, the origins of why this happens and build a picture for them to get to a point so they can want to be active in their physical therapy treatments or take part of a nutritional program with Belinda or Coach Be Fit? Is that something that you find having to do more is educate your patients on the not the root cause, but actually what the foundation is for some of these ailments such as arthritis?
Yes, and I definitely think that it's definitely important to push and to give them the understanding that, hey, sometimes if we don't use it, we lose it, right? And so when they have that osteoarthritis, we really want to make sure that they stay active and we always keep them mobile. And so we help them get an understanding of the disease process and the importance of staying active. I use the analogy of, it's like a car. You have to stay up on the maintenance of it because if you don't, things will start to fall apart. And unfortunately, sometimes as we get older, we are at more risk for different conditions. And it's very important for us to stay active. And we can start small. So, whatever their activity level of tolerance is, and we can work with physical therapy to build upon that.
Well, while we're on the subject of arthritis, what is the number one indicator of the ailment, and how would I know to really start paying attention to it and have someone take a look at it?
So the number one complaint that we see is multiple joint pain, um, whether it be in the hands, the knees. Some patients even experience it in their back, and so that's going to be one of the biggest complaints is that joint pain, or they feel like they don't. It hurts to move the joints. Can be worse in the morning time, and they say maybe sometimes it gets a little bit better. As they move more and go on about their day, but initially they feel a little bit stiff and there's some joint pain. So I think that if people are experiencing those symptoms, they need to get into their PCP and talk about it early, because the key thing is to optimize the mobility. You want to get them moving.
Right. And it never hurts to talk to a provider, especially a good group of people that have your best interest in heart, are looking out for you. And that's why we're so happy to be joined here by Dr. Airelle Rucker-Smith, nurse practitioner at First Choice Primary Care in Rockville. It did sort of bring me to another idea that I wanted to pick your brain on is, we were talking a bit about sort of the referral process going back and forth with physical therapists and other professionals. I was just wondering how you assess the need for physical therapy referral in patients and, what might sort of influence the criteria in which you make these recommendations?
So it's easy, when a patient obviously comes in with a musculoskeletal complaint to assess the need for physical therapy, but sometimes it's not always as straightforward. We
Mhm.
do at least or at minimum on an annual basis screen patients for any issues with mobility or issues with their activities of daily living, especially in our older population and our geriatric population. That's something that we talk to patients about, and on their initial intake screening forms, it asks them questions about their if they're having any trouble completing their activities of daily living, if they're having any active issues with joint pain, or mobility or balance. And so those things are an ongoing assessment, but we definitely do it on those first visits, and if they have any musculoskeletal complaints, and at least on an annual basis.
Now, when you have a troubled patient such as myself, and I'm having a hard time being truthful about my ailments, ho- during your intake process, are there certain steps that you take to try to get the truth out of the patient without having them to really say it?
Yeah, so even though they fill out a intake form, we still ask. So we ask again. I'm always assessing. I'm assessing as they're walking into the room. I'm assessing their mannerism. I'm assessing when they're sitting in the chair. I'm assessing when they get up to sit on the exam table. So if I notice anything, I'll ask about it. And I can't make someone share. I always want people to feel comfortable enough to share. But I try to also pick up on things too. We also ask about, any previous injuries and things like that, to see if there's some ongoing pain, or if they actually, completely return back to their baseline after that.
That's great. And that's one of the key qualities you look for in a provider, someone that can look at the issues but also look past the issues, try to find the root of the issues and really show that level of care that, they're looking out for your best interests. And, I know there's a lot of hoops to jump through at times and some tricky people to deal with, I'm sure, from time to time. But I did want to ask on the bright side of everything, what it was that maybe you loved most about your job or that you're most passionate about going in each day.
I think going in each day, I'm happy, and I'm happy because I am able to just build a relationship with my patients. And I try to make it so that they feel comfortable to talk about things. And sometimes it's not just about their medical condition. It may be something personal that's bothering them. And I'm just grateful that I'm able to have that relationship, to really get to know them, because that's what helps me to better offer treatment plans to them that are long lasting.
No, it's very important to develop those that trust and that relationship not only with your colleagues but also with the patients. And I wanted to know, as far as the women's population goes for women's health, because we have now a pelvic floor program that we've introduced in our Bowie location. I'm curious to know, as a nurse practitioner, is are you seeing more interest for specialized symptoms as far as in the women's health world or pelvic floor disorders in general?
I'm definitely happy that you guys opened that program up, because it was very hard to find a pelvic floor specialist for our patients in the area. And so we definitely, as primary care, we try to teach some of those exercises and concepts, but it's definitely something that patients will need direct one-on-one time with. And I think having that is very important. And we definitely do, from a primary care standpoint, refer patients who need, and maybe having like some urinary symptoms that we think are related to um, weakened pelvic floor muscles. We definitely don't hesitate to refer those patients out.
Absolutely. And, definitely can see the effect that having good resources and people around can have on a practice, and that's why we're so appreciative of you as well. The great practice you guys run. We're really happy to have our new office in Rockville, so we can work closely with everyone there, and I think it just makes for the best communication going forward.
Which is one of the reasons that we're happy to have you guys, both Coach Be Fit and yourself, be a part of this program, because my experience when I see you two, when I walk into your office or when you guys came down to Project PB&J was a united front, a solid energy, and it seemed like everybody knew their role and responsibilities and carried that out. And as the leader over there at First Choice Primary Care, what are some of the values you try to instill into your staff, into your team?
They're the core values of the practice. I think when I created this practice, I really wanted those core values to be built into our culture. And those core values came from things that over my years, I've talked to patients and they really wanted into our practice. So really making sure that we lead with integrity, that we're always compassionate, that we're accountable, that we're reliable, and that we are always promoting equity in everything that we do.
100%. And that idea of staying accountable, leading with integrity. I did want to know, sort of, in terms of working with other practices, doctors, surgeons, whatever it may be, what are some of the top things or qualities that you look for in, other practices you work with? Is that, definitely, I'm sure, having a strong level of communication? Are there some big, red flags you've seen before, or some big green flags that you've seen as well?
I think the things that I look for are definitely communication. And then those same core values that we have, we do look for those same core values in other practices because our patients expect a certain level of care. And if I refer them out to a practice that may not be upholding those values, I'm going to hear about it. And it's also a reflection of me, believe it or not. And I've had patients come back
Well, everything's a
and say,
reflection of you
hey,
regardless there. So that's
no, but
one
I
you're not
mean,
running from.
yeah, so we've had patients come back and say, "Hey, I went here, but it wasn't a good experience," and we don't like that. And so we try to minimize that as much as we can. And so that's one of the reasons why I also try to build relationships that I know, the practice. I can say, "Hey, you know, over at such and such, staff is awesome. The provider's going to take good care of you," and I can say that from my heart.
Well, it sounds like you take the time to vet everyone and make sure that, your name is being taken care of and your business is being taken care of. And I think that's very important. And the good people over at Start PT now do a great job of that. And more importantly, I want to ask you, what has been the biggest challenge you have seen as being a female owned uh, owner in the healthcare space
Ooh, biggest challenge.
to date?
I got a laundry list. No, I'm just joking. I don't. I would say, the thing that I get the most is my age. People will
Okay.
comment on my age or the way I look. They think that I'm very young, and so I get that a lot. I get a lot of questions about my background, but I don't mind answering the questions. Um, but I would say that that's definitely something that I come across a lot.
Well, definitely. I think that's a challenge you easily overcome once they get to know you and see exactly the great work you do over there. And before we let you go, we have Rye Guy has one last question for you. And thank you again for joining us and a really awesome segment today. I feel like my brain is opening up every time I do this now.
Oh, you guys are so welcome.
Yeah, absolutely. And yeah, I definitely agree with Leo there. It's always a pleasure, again, to sit down, speak with you guys. And I just had one more question for you. You got the gears sort of turning for me talking about, being a female-owned practice and what that process must have been like. I just wanted to ask, going back to that time when you were first getting everything started up, what are some of the fondest memories you have of that experience?
Ooh, some of the fondest memories. This practice is like, and I'm sure many people say this about their
Your
business, it's
baby.
like a baby. Yep. And so watching it grow is like so like fulfilling to me. We started as a telehealth practice. I was in my home, in the office, on the computer, seeing patients. And the goal was always to get a physical space, but I personally started small to keep overhead costs small. These practices, as you know, they cost a lot of money to run.
Right.
Um, and in the earlier stages of any business, right, you're growing, you want to keep that cost small so you can be sustainable. So I say those are my fondest moments of looking back where we were, where we are now, and looking to the future.